Right, so quickly trying to look at evaluation of a child with severe acute malnourishment. Right. So if a child has severe acute malnourishment, how can you be able to evaluate the child? Right. Try to establish that the child actually has a severe acute malnourishment, or try to treat, or try to see how the child is responding to therapy and all of that. So first of all, you have to take a medical history, physical examination, medical history. So for the medical history, you ask of the usual diet of the child before the child actually becomes ill. Then you ask about all those breastfeeding, immunization, complementary feeding details, right? I'm coming. Right. So for food and fluids, you also ask it about the food and fluids that the person has taken in the past few days or 4-hour dietary recall. So duration and frequency of diarrhea and vomiting, time when urine was passed last. Right. You ask if the child has had any contact with anybody that has measles or tuberculosis. You ask about the family type, family size, family income. You ask if any of the siblings has died of recent. You ask about the birth weight, developmental milestones, right? Calculation of protein and what calorie content of children's food, feeding technique and food habits. Okay. Alright. So you ask about the family type, the size of the family, the income of the family, right? You ask about if any of the siblings have died. You ask about the birth weight and which times they actually reached some specific developmental milestones. Then calculation of protein and calorie content of what children foods, feeding techniques and food habits, right? Then for physical examination, you're trying to look out for the weight, for the height. Then alright, so basically you are trying to compare it with children of that same age group. So you check out for if there is enlargement of the liver, presence of severe pallor, jaundice. You check out if there's abdominal distension. You check out if there's bowel sounds, presence of fever or hypothermia. Test. You check out for corneal lesions, which will indicate that there's vitamin A deficiency. You examine the ear, the mouth for evidence of infection. You examine the skin if there's evidence of infection and purpura. You check out for the respiratory rate, positive chest signs, then appearance of the feces of the child. Right. So that's just how you can be able to examine a child that has severe acute malnourishment.